Today I have Dr. Sneha with me, and I'm extremely excited about it. I hope so are you. So today our topic for our chat show is ways to cope up with the current COVID scenario, and we have our expert sitting with us. Dr. Sneha is a clinical psychologist and a RECBT practitioner. So it is a pleasure having you here, ma'am. So please just introduce yourself to our audience.
Hi, Kavya, and I'm Sneha Shah. So I am a clinical psychologist and RECBT practitioner. I'm practicing in this field since around 4.5 years, and yeah, so it was very great to have me here, and also thankful to the Solh Talk for having me here, and so for such a useful and wonderful topic which is needed in each and everybody's life right now.
So shall we start the chat show?
Yeah, sure. Yes.
I'm super excited.
Yeah, same here.
Okay, moving on to the first question. So, is there any way that you feel that you have some fears or somewhere you or the other you're affected by COVID? How is your mental health has been affected by COVID?
Um, See, this is the question where each and everybody might have some of the other fears or something. So yes, I likely was mostly like affected with COVID scenario with COVID, and I have also experienced a fear of losing people and
Right.
also even dying myself. So this COVID has inculcated many of such another fears in our lives, in our minds. However, as I started practicing my own my own daily routine, which I'll be surely sharing with you all, right, in the questions also. And because of that, what I have overcome this COVID scenarios slowly, gradually, and so I feel better empowered to take on COVID or anything that life is throwing on us. So this, I'm sure, each and everyone, if they follow gradually, this can be a good way to tackle each and everything which is coming on in the life.
Right. So, what are the ways in which a person can overcome the current scenario and the fears and what he is manifesting to the time?
Mm, there are many ways, but to overcome their, see, the current, what can I say, the COVID, COVID has gave us so many shocks where we were about to tackle our own problems, but because of which we are such in a dilemma how to overcome all that things. So COVID scenarios are very critical in themselves only. Maybe bringing predictability or a little bit of routine in our own life might definitely help. So now if we tell about the routine, what type of routine and what type of how this will help you, so firstly, I suppose, I feel, as soon as you get up there and multiple times in your day, just affirm yourself and tell that I am safe, I am good. Appreciate your body, your own mind, your own thoughts, so as how well you manage your thinking. And then thanks the vaccine which you are already taken it, and with all the support of your systems, your life systems, your support systems, take everybody's name with you, thank them personally and also in your minds. And this is the sign where it is, you are showing that there is no threat. Your brain needs a type of signals, so these all are the affirmation and the activities where you find you can tell your brain that there is no threat in any of the things. Also, make affirmation appreciation for every part in your life. Secondly, schedule that mirrors, schedule everything which you were doing before the COVID. Get up early, even if you are not going office, you are working home. Get up early, do all the course which you are doing presently, previously, then the traveling gap which you had and now you don't have, maybe many of the, since offices are doing work from home, you can do something creative into that timing. Also start up with your hobbies, maybe. Most importantly, limit your time in phones, in computers, in laptops, if it's not necessary, because it is said if the bucket is full, water will spill out, obviously. So if all the useless, that information are just filled up, the main and uh, the main information will not be there, it will not be fit in your mind. So it's better if you just focus on the main information only, and don't drag with all the useless informations. Also, whatever time you spend on mobile, try connecting with your friends and family and call them, make sure they are okay or not. You can share about your achievements, disappointments, everything. And every time you are overwhelmed during a day, you can use grounding technique, which is 5 4 3 2 1, where you can count 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. This automatically allows you to be mindful. You can affirm yourself that I'm flushing all the negativity in, and whatever it's there in my mind, I'm flushing everything. So this is the type of relaxation you can say. And also this, all this routine which is needed takes 21 days to just form persistently. So
Right.
I suppose if anybody or anyone is trying this out, sure, try this out and don't end this habit after the pandemic ends. So yeah, I think the person can automatically plus gradually overcome due to this.
Absolutely. So, shall we move on to the next question?
Yeah, sure.
Do you believe that COVID has become more of a mental hazard than a physical threat?
I would say India was already struggling with the mental health awareness and resources before the pandemic. Okay, so now when the pandemic has hit, the focus was all on the physical health and hygiene.
Right.
And people were and continue to struggle dealing with the loss of loved ones, sleeplessness, anxiety, stress, behavioral issues, relationship issues. So this, if left unresolved, this could lead to many severe disorders more. And the lack of mental health awareness and resources have left a big hazard, of course, to the entire nation, also, which we all professionals may have to struggle, to again come into the line and again show this awareness. So yeah, it is the biggest hazard. Mental health has always been a biggest hazard, and now it is.
That's true. Exactly. I think people around us is the key reason for us to have a mental health strategy towards anything. If people
Yeah.
around us has start normalizing COVID, our mind will automatically do that and feel that. If I'm 24/7 talking to myself that I'm not well, then I might feel that I'm not well, even if I
No,
am.
yes, yes, completely. Your mindset, matters everything.
Right, absolutely. So moving on, COVID has taken many loved ones from people. They have lost their loved ones. So it's something that is a person is deeply disturbed when something like that happens. So what is your tips for them to overcome the grief and overcome the fact that they have lost something very important?
Um, I would say this is a misconception that being strong after a loss means that you should not grieve. Okay, and the life goes as usual. This is not the thing. Also, grieving is the best natural way to cope up with the loss, and not only with the death, which is so final, but also to separation, relationship issues, divorce, etc. So it typically will go through 5 stages, and which really just thoroughly means that you should not bottle your feelings.
Absolutely.
Also, if you are struggling with coping with a loss, or a major separation issues or something, a loss of a death of loved ones, you can talk to a counselor. And also you can go through these stages, like first is denial, pretending that you are okay and life has to go on. This mode is very dangerous, where this is like anesthesia. It just numbs your pain for the time being, so that you can go through that and just say goodbye to the loved ones and just go ahead. In case of death, even if you were unable to say final goodbye or go to the rites or final rites or something, you just need to come back from that denial mode कि ऐसा भी कुछ हो सकता है या. Also, second thing is anger. There's always a question, why me? Why am I suffering? Why am I left alone? Why he left and am I left him? So all these things, somewhere pain is suppressed and you are just releasing the anger form.
Right.
Also, here anger management techniques can be used. Then is depression, where there's a tendency to retreat from social scene as we process our new reality. You can use behavioral activation here, like doing activities that gave you pleasure before your loss. You can try it, all that.
So what
And most important, yeah, sorry.
exactly are these behavioral activities? Like, what can we do about it?
See, yeah, so you can do, all the things, like if you have gone through some of the loss of your loved ones, you can do all that activities which you were doing before his or her loss. Like if my sister was there and she just had a bad death because of COVID, I can just do all that things which I was doing with my sister, like going to a garden together, going for a movie together, liking each other's activities or hobbies. Like she likes singing, so I would rather also do singing and be happy with all that moments which I was having and now which I can do. Basically, in this way you can just think that I can make proud of my sister and also think positive in a way that maybe she or he will like this, because
Right.
she was liking this thing, I can do that. Also, next thing is acceptance, which is very important. That is when you accept the new reality, that separation has happened, divorce has happened, a loss of a loved one has happened, and now which physical presence is missing, he or she will always be present in my memories, in my soul every time. So all these stages need to be grounded over.
Absolutely. So, as you said, these activities and these tips and tricks a person can do, but are these sometimes they can go to extreme levels also? A person after a grief or something happens, so
Yeah, it can go to certain level where not only these tips will be useful or beneficial. Over there, a proper treatment plan, a proper therapy works, where a counselor and psychologist takes you into a proper action plan. So yeah, there are some cases which are extreme, and there are some cases which can be handled due to this or this trips also.
okay, thank you. That was really
Yeah.
helpful. So, moving on, how is COVID affecting the lives of people? Like, how is exactly? It's just not something which is physically happening to me and I'm overcoming it. It is just for example, me, if I had COVID and I have recovered from it, but still that thing, the fear in my mind is still available. So, how is that affecting people? What exactly does COVID doing to people?
It has been 2 years since the first case was reported in India, So, and in addition to that, the spread of disease and increasing death numbers,
Hmm.
we have experienced a lot of, social isolation
Right.
due to lockdown, curbs and restrictions, feeling of hopelessness, helplessness. Also, seeing our already overburdened healthcare systems crumbling, devastating deaths of loved ones, panic attacks, fear of oxygen bottles, tanks, and like people, walking back to their hometown, rising COVID cases. So they, studying offline to online. Everything has changed. The people are really getting affected and have got affected. Also, relationship breaking, then increased number of suicide because of depression, anxiety. Even though there were so many support system numbers for the mental health clients or issues of patients, but still there were many I feel there were many cases which were not touched also. They knew that there were any of such of the support numbers or such. Okay, so unfortunately, people have only been reacting because of this unpredictability of the virus variants and the different waves bringing in more devastation before they have resolved in our minds. एक एक करके they were just piling up before these all were resolved. So obviously the people's mind and hearts were surely getting affected.
Absolutely. So when they're affected with so much, and there are certain cases that get extremely severe because they cannot be treated with the simple tips and tricks, as you said, like
Right.
clinical depression and things like. Then what? How can a person know that he's suffering from something like that severe that he needs to visit a psychologist? How can he know about that?
See, the simple trick is that if some or the other thing is, bothering you,
Right.
as per say, a small issue is bothering you and you are not able to do any of your routine work because of that thoughts currently, it just comes up and again, and it so much bothers you that any of your routine simple thing you cannot do. It's just, making you irritate somewhere or other, where it longs, the duration is so long. It's like 1 week, 2 week, a month or so, or 2 months, where somewhere you feel you really need a help.
Right.
Okay. And also many of the people just think that going to a counselor is waste, or a psychologist is waste, and let's go and to talk to your friend or anybody who is close to you. I'm sure this is also a good thing to share things with your best friend or your anybody who you are close to. But somewhere I feel you have a fear of being judged, and where you feel that being judged is the main issue, where you can you are lacking in everybody. So
Right.
the psychologist or therapist are the one which you should have no fear with. I mean, they don't judge you, they don't have any of the personal attachment with you. So in order to just be free, you can really be free with them. So yeah, that duration longs where your thoughts, your each and every work is just bothering it because of this. You That is definitely a sign where you need to go and visit a psychologist. Even though if there is nothing, if you are just growing good, you are doing well in your life, I am really happy to say that each and every person really needs a therapy or a counseling, even if there are no problems. So this is just a stigma where if you have problem, go to counselor, if you have issues, go to psychologist, or else no. So this is where we need to break it, even for growing our better life, our better well-being, even for our personality, thinking, your positive leading life. Counseling is not only for the problems and issues, it is also to grow, it is also yourself, where you can just be yourself and grow in your life.
Thank you so much for
Yeah,
being with us. I had a really wonderful session. Hope you
same here, same here, Kavya.
our audience did learn a lot of things from you, and I also got a new thing. I just have my last question about your designation. What exactly is a RECBT practitioner? What exactly does he do?
So this is a therapy where if you have heard somewhere, we usually our minds work in a cycle form, where we think whatever the thoughts we are it's coming in our mind, we think, we start something catches our mind, we think, and then we have to behave in such a way, and then we speak. It's everything in a cycle form. So whatever comes to our mind, it catches your mind, you think of that, you just restore everything in your mind, and then you start reacting, and then you start telling yourself. So all that cycle is what about REBT also. It's about the negative emotions, taking out your negative emotions, negative perspective, and replacing with the positive one. There are many rigid thinking thoughts which come up to our mind, and where you are stuck in that. So in a simple way, in a simple language, it's just to reverse and translate your negative thoughts and your negative rigid things to positive ones. I am telling in very bare simple languages. Yeah, it is more than that, but yes, I'm just telling it in short and simple language.
So, matlab, what people, when should a person visit some RECBT practitioner?
No,
When?
so this is not a thing where you just have to do it on own. I'm sure you can do it on your own, but yeah, firstly, if you visit a psychologist, if and he or she is practicing RECBT, in
Yeah.
his or her therapy. I'm sure within the session they'll teach you how this works, and once you are pro at it, after uh, uh, just if a psychologist sees you are doing a perfectly fine with all the activities, this can be done at home also, but after learning it,
Right.
like, yeah. So nobody has like, okay, I want to go to RECBT therapy. No. So it goes line wise. Each and every person has different issues. So each and every person has different therapy to work on.
Right.
So yeah, different things works.
So done with all the questions. It was
Okay.
absolute pleasure, and thank you so much for being here. And I'm looking forward to see you at the last session with us, the chat
Yeah.
show 3:15. I hope the audience is as excited as I am. So see
Same
you.
here, Tavia.
Thank you so much.
Okay. Thank you.
Bye.